Hello, sir. I've got a team here that's taking pictures,
Oh, really?
but I've instructed them that they have to take off their shoes.
Oh, thank you so much, Doc.
Okay.
Hi,
All right.
how are you?
He always gets to see the holes in my socks. There we go. The doctor took off his shoes. Good to see you, sir.
Same here, Doctor.
Yeah.
Same here. I like that tie you got on.
Well, thank you. How is your lovely wife?
Well, she's doing pretty good.
Okay.
Doing pretty good. Mary.
I don't think it's a cold. I don't think it's a virus that's causing that. And has she been having fevers or
No, I've been
discharge or anything like that?
I've been taking the temperature, just like, coming from my nose.
Yeah. Watery eyes at all?
Yeah.
Sneezing? Not sure. It does not sound like it's a cold. Let me take a listen to her.
Mary. Mary. Wake up, baby.
Okay. I hear that so often. I don't want to be a burden to my family. And this is the patient saying this, you know. And what I say to them is, you know, your family wants to be a caregiver. You know, they see this as an opportunity to give you back something that they couldn't otherwise give, that this is a sign of love. How long have the two of you been married?
56 years, almost 57.
Wow.
Yeah, 56 years.
Great.
And Mary has been not quite like this, but like this for almost 19.
Really?
Mm-hmm.
So you have been her primary caregiver for a long time.
Well, I didn't know I was a caregiver.
You were just her husband.
It just eased in on me.
Yeah.
When one day I woke up and I said, boy, what's happening? I'm a caregiver. So
Yeah. Very good.
I relished the opportunity.
Caregiving for him is a sign of love. And that is very, 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 very true.
It's just another opportunity for me to show her how much I love her. So that's
great.
My definition of a caregiver.
That is very good. I'm going to remember that and tell others about that. I think you're right on target. Well, thanks for letting us in your home.
It's my pleasure. Thank you for helping us out.
You bet. I always enjoy coming by and seeing you, always.
Actually, when you work in the hospital, I was just saying this to one of the other guys, that surgeons refer to us as hand holders. But that is a good deal of what we do, because the patients that we see are so dependent on the care of their caregivers that if they're, it's just like a child is dependent on the mental health and well-functioning of the mother and the father. A patient who is really sick is dependent on the well-functioning and as much as possible the mental health of the people who take care of them.
The family reactions that I have witnessed have been extraordinarily gratifying. The feeling of relief, and clearly you get a sense that as a result of the house call's intervention, that the quality of life for the entire family is going to improve because the house calls team has relieved a level of stress that had really been weighting them down.
One of the good things about it, though, because I've been doing it 2 years now, is that I think you become part of the family, though, and you in that you learn about the birthdays, the graduations, the grandbabies, and so it's hard when one passes away and you become really attached. So it's like they're your family too, you know.
Okay. Greetings. Howdy. How you doing?
I'm doing pretty good.
You're looking good today.
Gee, thank you.
It's been a while since I've seen you.
It
Has
you deserted me.
Oh, I didn't desert you. How things are going?
Oh, things are going so.
Any problems since I last saw you?
Oh yes.
Like what?
You see, I'm short of breath now. That's the distance from coming in there and here.
Right, that's a short distance.
Also,
Getting out to see a doctor and getting primary care has gotten to the point where it's generally doesn't happen unless I come out and see them.
Here in the state of Ohio, we have basically, for people needing long-term care services, 20% of the folks are in the community, 80% are in nursing facilities. So right now, at this time, we're trying to flip that equation. We want really to have just the reverse. We want more people in the community by choice and using institutional care as it's needed. And it's needed at some times, and it is the appropriate choice. But we'd like to, as I say, delay that as long as possible or avert it altogether for some people.
I would like, if I had the ability to have all our clients on a home care program based on their choice, we would do that.
I was a little disheartened in medical school with that inability to connect with patients and just not seeing what I kind of was passionate about and establishing relationships and things like that. And then this was a perfect way to see that it still exists and that there are still ways that doctors can find ways to really spend time with their patients.
You keep the mind active, you keep people engaged, you keep them a part of the lives of the people around them. They feel more alive too.
I mean, we just support pretty much everything for the patients and the caregivers. And
Well, that's
it's
actually
very overwhelming, but at the same time, it's, fulfilling for me because I'm a compassionate person and, it's very rewarding. I just really love to do it.